Today, we're diving into something really complex but also incredibly human: dissociative disorders. These conditions show us just how far our minds will go to protect us from things that feel, well, unsurvivable. It's a fascinating and often misunderstood corner of psychology.
So let's start with something you've probably felt before. You know that feeling when you're driving and suddenly you snap back to reality and can't remember the last couple of miles? Or maybe you're in a meeting and your mind just checks out. That feeling, that sense of being on autopilot, that's actually a super mild, totally normal form of dissociation. And that's really what dissociation is at its core. It's a separation between your actions and your conscious mind. Think of it like a mental escape hatch. When a situation gets too stressful, too overwhelming to deal with head-on, the mind can just disconnect for a bit.
All right, so let's dig into that a little more. What exactly is this mental escape hatch? And more importantly, when does it cross the line from a common experience into something that's a real clinical problem?
Yeah, it's so important to remember that dissociation isn't an on or off switch. It's a whole spectrum, right? On one end, you've got everyday things like getting totally lost in a good book or just daydreaming. But way over on the other end of that spectrum, that's where you find the clinical dissociative disorders. And that's when this escape mechanism becomes so intense that it starts to fracture a person's memory, their identity, even their whole sense of self.
So what do these more severe forms actually look like? How do they show up in a person's life? Let's break down the different ways dissociation can manifest. Okay, first up is dissociative amnesia. Now, we're not just talking about forgetting where you left your wallet. This is a profound inability to recall really important personal information, and it's almost always tied to some kind of traumatic event. And then there's a more extreme version called a dissociative fugue. This is when the amnesia is paired with, well, sudden unexpected travel. A person might literally find themselves in a new town, maybe with a new name, and have absolutely no memory of their past life or how they even got there. Then you have something called depersonalization disorder. And this one is really surreal. People who experience this often say it feels like they're watching a movie of their own life. They describe feeling like a detached observer, just looking at their own thoughts, feelings, and body from the outside. You can imagine how disorienting and frankly terrifying that would be.
And then we get to probably the most famous and maybe most sensationalized one: dissociative identity disorder, or DID. You've probably heard of it by its old name, multiple personality disorder. And the key thing here is the presence of two or more distinct identities, often called alters, that kind of take turns controlling the person's behavior.
And to make this less abstract, our source material gives us a really powerful case study. It's about a young, shy boy named Muna. During a therapy session, his entire being just shifts. His voice changes, his posture, his whole personality. And he introduces himself as Munim, who he says is a rough and tough fellow. I mean, that's a perfect real-world example of how profound this fragmentation of identity can be in DID.
Okay, seeing all this, you have to ask the big question, right? Why? Why does the human mind do this? What could possibly happen to a person that would cause them to resort to such an extreme survival tactic?
And here's a really critical point from our source material. These disorders aren't really seen as being biological or genetic at their core. Sure, some personality traits might make someone more vulnerable, but the root causes, they're overwhelmingly psychological.
The main psychological explanation really comes from psychoanalytic theory. And the idea here is that dissociation is a super powerful defense mechanism. When you're faced with trauma or a conflict that is just too painful to handle, the ego, which is like the conscious decision-making part of your mind, has to find a way to protect you. And dissociation is one of its most powerful tools.
So how does that actually work? Well, it breaks down like this. First, a person experiences something incredibly painful. Their mind looks for an escape route from that pain. So it activates this defense mechanism called repression. Now, repression isn't just forgetting. It's the mind actively pushing that painful stuff, the memories, the feelings, so far down that it becomes totally unavailable to your conscious mind. It's like locking it away in a vault. And that very act of walling something off, that's the engine that drives dissociation.
So the causes are deep and complex, but the good news is there is absolutely a path to healing. So how do therapists help someone start to reconnect those fragmented parts of themselves? Let's talk about the pathways to treatment.
Okay, this is so important. The main goal of treatment is not to get rid of the alters or to just erase bad memories. It's all about integration. The whole point is to help the person safely access those walled-off memories, feelings, or identities and gently weave them back into a single, cohesive sense of self.
And when we talk about treatment, this comparison is everything. Psychotherapy is, without a doubt, the main event. It's the primary treatment, focused on gaining insight and working toward that integration. Medication, on the other hand, plays more of a supporting role. It can't cure the dissociation itself, but it can be really helpful for managing related symptoms, like depression or severe anxiety, which makes the hard work of therapy a little more possible.
All right, so let's do a quick recap of the big takeaways. First, dissociation is basically a mental escape from overwhelming stress or trauma. Second, it shows up in a few key ways: amnesia, feeling detached, like in depersonalization, or having separate identities, which is DID. Third, it's understood mainly as a psychological defense, that process of repression we talked about. And finally, the path to getting better is through psychotherapy, with the goal of integrating all the pieces of a person's experience back into one whole. And that really leaves us with one final powerful thought. I mean, while these disorders cause so much distress, they're also kind of a testament to the mind's incredible will to survive. It really makes you wonder, what does this all teach us about the profound, almost unbelievable power of the human mind to endure the absolutely unsurvivable?